They're not Facebooking or whatever, they're actually doing the reports on electronically now for us, so we'll be getting that way. Let's see. I think I'm trying to replace my car. My car has 182,000 miles on it, so we're going to be talking to the council about getting that, so hopefully you'll see a little used Explorer around town here shortly, if we get the approval. But other than that, we don't have anything new, I don't think, to tell you. So we'll just turn this over to them, and so you all can get out early. Miss Charity Dameron is set this up and everything, so she'll tell you everything that she does and what's going to happen.
My name is Charity Dameron, and I'm the director of the Wayne County Family Resource Network, and I'm also a member of the Wayne Awareness Towards Cancer and Health Coalition. And what our coalition does is we do tobacco prevention, substance abuse prevention, we also do health and wellness prevention, and we also do set up health fairs and cancer screenings for free for the public. The Family Resource Network, we're a nonprofit organization, and we work together with social service agencies to build a better future in Wayne County for children and families. We do this by looking for grant funding to provide extra services or to expand much needed services throughout our county. We also hold the Substance Abuse Prevention Grant for Wayne County from the wonderful folks at Prestera and the West Virginia Behavioral Health and Health Facility. Tonight we've got Tim White with us from Prestera. He is our Region 5 Prevention Coordinator, and he coordinates all of Region 5, which there's 10 counties involved in our little east side region here, so, or west side, sorry. So he's going to talk to us tonight about marijuana and heroin, and he's also going to give you some tips on how you can talk to your kids, talk to your neighbors, and stay safe. And after that, we're going to have a little panel discussion with some state police and law enforcement and Tim and some folks from mental health. So thank you all, and welcome Tim White. Oh, I'm sorry. I'm sorry. See, I told you when the TV cameras come on, I get really tongue-tied. We have a letter from the Honorable Nick Joe Rahal. Sorry. Dear friends, I commend everyone who helped organize today's forum, and I want to thank each of you today for participating. One thing is abundantly clear: drug abuse and addiction is bigger than any one individual, family, or neighborhood. It is a problem the entire community must address. The more citizens engaged in a meeting, the many challenges the drug abuse epidemic generates, the better the community can answer those challenges. A recent survey found that over half of those children aged 12 or older who have used pain relievers, sedatives, stimulants, non-medically, got the prescriptions from a friend or a relative for free. I know I am preaching to the choir here, but two well-known points bear repeating. We each have a responsibility to take care of our own. That means not sharing prescriptions, keeping the medicine cabinet under lock and key, and being ever vigilant of our children and family members' own behaviors. Any changes in behavior patterns need to be closely scrutinized and carefully addressed. And a tandem point with all of this is the old Ben Franklin's wise words remain just as wise, that an ounce of prevention is still worth a pound of cure. Educating our children and family members about the dangers of drugs is still the wisest and most frugal investment we can make in this fight. There can be no question that prevention can be best begin at home. To assist with the prevention measures and to help combat the other battle fronts of drug abuse, I have been leading the charge to put the necessary federal funding into state and local efforts to fight the scourge, as well as bringing our area and its fair share of that funding. I look forward to working with you and successfully turn the tide on the currently deadly menace of drug abuse. To everyone here and to your families, Merry Christmas, and may your new year truly be peace on earth and goodwill towards men. Sincerely, Nick Joe Rahal.
Well, people say, why in the world are we talking about marijuana and heroin? Well, if you look at it, you're probably looking at both spectrums. Obviously, on the lower end with marijuana, and now the major problems that we're having in our area on heroin. We're funded through the behavioral health and health facilities. We certainly believe that prevention works. I know that treatment is effective and people recover. And so it's important that we understand the whole spectrum of what we're doing, not just prevention education, but doing everything we can to get the resource of the folks that need it. Again, that's my information there. So our learning objectives mainly is to learn about marijuana and the research on marijuana as medicine. If you all have heard that there's the potential of a bill being sponsored in Charleston that would legalize marijuana in the state of West Virginia. So that debate is going on. We're going to be talking about how to recognize the issues surrounding the medical marijuana debate, understand the importance of reviewing scientific research literature in order to make that decision. So we want to talk about marijuana or cannabis. How many of you ever heard of a website called Urban Dictionary? All right, if you haven't, you need to familiarize yourself with it. There's an app on your phone that you can download. It's free. Urban Dictionary is a place that if you hear a word, you see something and you're not sure about it, if you type it in, it's going to give you the street slang for that. For example, anybody know what 420 is? What's 420?
Something to do with, I think, a time of day that people do something. I don't really know all that much. You know, David?
420, April 20th, okay? 420, again, is a penal code for marijuana, but on April 20th, that's where they want to have their national smoke out. They encourage folks on April 20th to smoke marijuana or use marijuana. Again, if you don't know that, if you were to go to Urban Dictionary and put that in there, it would tell you that that may be what they're talking about. How many, any Keith or Dierks Bentley fans here? Anybody heard the song 5150, somebody called the Popo? Anybody know what 5150 is? From a Van Halen album? Again, it's referring to someone that is totally out of control, that they're going to have to be taken away to an institution. So he's saying 5150, this party's going to be so bad, go ahead and call the Popo. But if you don't know that, we sing those songs all the time. Kids hear them in different songs. So if I hear a song, a rap song, country western song, I hear something on the radio, I see kids texting something, I see a tattoo or a graffiti, I can go to Urban Dictionary and type that in there, and it may give me a clue of what they're talking about. So some of the street names or the slangs for marijuana, again, is weed, pot, 420, grass, hash, joints, Mary Jane, chronic herb, and dope. All right? So what is marijuana? It's a dry, shredded green and brown mix of flower stems and seeds from the hemp plant or the cannabis. More concentrated, its resinous form known as hashish, also a sticky black liquid as hash oil, typically smoked in hand-rolled joints or blunts. Anybody know what a blunt is? Yes. A blunt is where someone would take a flavored cigar, they would take a razor blade and or a knife and cut it. They would take the tobacco out of the cigar and mix it with marijuana. Then they would put that mixture back in the cigar and smoke it. And what happens is you begin to smell the scent of the flavored cigar instead of smelling marijuana. Okay? Because if you've ever smelled marijuana, you know exactly what it smells like. Okay? Very pungent. So what it is trying to mask that with the flavor and the scent of a flavored cigar. Also, the main active chemical in marijuana is what we refer to as THC. All right? So, the average potency of marijuana has more than doubled since 1998. Actually, it's about 70% stronger than what was out there on the streets back in the 60s. I tell people, this is not your grandma and grandpa's weed anymore. Okay? The potency, the THC, the stuff that's in that stuff, and now they're finding it where they're mixing other chemicals or other drugs into it. All right? So there's also synthetic forms of marijuana, which is called K2 or spice. All right, that was done in a research lab to try to find an alternative to marijuana. Okay, so and the problem we're having now is right now there's about 10% of the marijuana user population has an addiction to marijuana. But what we're finding with K2 Spice is 3 months use of that stuff, they've built up a very, very strong addiction. Not normally associated with someone that would smoke marijuana or use weed. So if someone says, well, it's not as bad if we do the K2 or Spice, we're finding that it builds that addiction a lot quicker. Maybe a little bit hard to see on this chart from where you guys are saying, but what we've done is percentage of marijuana use in the past month among those 12 and older in West Virginia. This was from 2008 to 2011. So you can see again, the red line, 18 to 25-year-olds, has the highest. High school students reported marijuana use in the past 30 days. Again, you can see the blue line is the national, and then the yellow line is West Virginia. So let's talk about marijuana as a medicine. Marinol, which is in synthetic form, and when I use the word synthetic, I mean it's man-made, okay? Is cocaine synthetic? Is cocaine synthetic? Is cocaine man-made? No, it comes from flower, right? Poppy. Okay. Is marijuana synthetic? No, it comes from a plant. Is meth synthetic? Yes. Meth is synthetic because it's 100% man-made from chemicals. All right. So there is Marinol, which is a synthetic brand that is being used in the medical field. Okay. Again, another one, the Debulon, a synthetic analog of THC, approved for prescription use for treating nausea associated with chemotherapy. So there's already drugs out there that have the same equivalent, if not better, than what someone would use if they were using straight up marijuana. Others are approved in other countries. Again, you can see those named there. Let's talk about street versus medical. There's absolutely no difference, ladies and gentlemen, than the marijuana sold on our streets and the marijuana that's used or prescribed as medicine. No different. No different. Okay? The raw plant-based form of marijuana sold from a medical dispensary is the exact same quality and carries the same risk as marijuana sold on the streets. So, many advocate for medical marijuana argue that there are hundreds of research studies on the benefits of marijuana. However, many of these examine recreational use. Results of 2 studies examined peer-reviewed medical literature from 1975 to 2009 worldwide. Total of 109 controlled clinical studies with a total of 6,125 patients. They examined a variety of health issues. They used it. What was the impact of smoking marijuana on pain? What was the impact on appetite, nausea, extreme weight loss? Did it have any impact on multiple sclerosis, glaucoma, or others? Much of the literature is mixed, but there have been some discovered health benefits. For pain, some studies have found improvements among patients who did not respond well to other pain medications. For appetite stimulation, a handful of studies found improvements in appetite, and some patients gained weight. And some for nausea, improvements were observed in a majority of cases. The common side effects noted across the studies include drowsiness, dizziness, confusion. 85% of the studies had less than 100 people. 70% had fewer than 50 patients. All of the studies were short-term in nature, lasting less than 1 year. Okay? Of the 109 clinical studies, only 13 or 12% examined smoking marijuana. Only 6% of the participating patients smoked marijuana for medical use. The results were mixed with some improvements observed and negative side effects included, again, sedation, euphoria, hallucinations, impaired posture, imbalance, sensory alterations, and decreased blood pressure. Again, these are some of the actual studies that were done, okay? And what you see in the middle is the number of people that participated in that study. So the first study was done in 1979. There were 15 cancer patients, all right? Then when you look again, when you look down to 2009, there were 28 people who had HIV in this particular study, okay? So 2 key factors in defining medicine. Number 1, consistent, standard, measurable dose. Second of all, is generally accepted delivery system. Okay, aspirin. You know how many aspirins to take, how often you need to take them. If your blood pressure, it's measured. Right now, most of your medication is based on milligrams. So if a doctor prescribes you to take 1 20 milligram oxycodone in the morning, it'll have 20 milligrams. It's measured, it's on there, all right? In the U.S., the Food and Drug Administration reviews the existing evidence for all drugs prior to approval for medical use. So, let's talk about marijuana as a medicine. Number 1, is there a measurable dose? The raw plant form of marijuana is not measurable. It's not measurable. Concentrations vary widely between plants and parts of the same plant. It's not possible to know purity or dosage from plant to plant. So let's talk about the delivery system. Smoking is not an approved delivery method. I was talking to one doctor and he said, yeah, I've never prescribed any of my patients to smoke a drug. Because the moment you put heat or you put flame to it, you're going to change the chemical makeup of it. All right? So you can't control that. Second of all, its combustion leads to change in the purity, dosage, and is impossible to measure in a standard way. The majority of research points to marijuana containing the same hazardous material as are in cigarettes. The American Medical Association, this just came out. Washington, D.C., November 21st, 2013, less than a month ago. Coalition for a Drug-Free California encourages Americans and the media to share the American Medical Association's, the AMA, strong stand against pot legalization. Here's what they say. Rumors have been circulating that medical associations are somehow supporting pot legislation. Let's put that rumor to rest once and for all. The American Medical Association this week made that point very clear, and we commend them for speaking loudly on this important matter. Said Dr. Paul Chabot, President of the Coalition for Drug-Free California. The AMA's 257-member House of Delegates decided during its interim meeting in National Harbor, Maryland, to retain their long-standing position. Dr. Mike Green, an AMA member, stated, AMA believes cannabis, which is what they refer to as marijuana, is a dangerous drug and as such is a public health concern. The AMA is the largest national organization representing American doctors with over 200,000 members. Okay? So, but it's natural, but it's safe. Anybody want to touch or play with those? Anybody got a problem with poison ivy? Sumac? All right? Just because something is natural doesn't mean that it's going to be good for us or healthy for us. And you can certainly see by those items that are up there. So, marijuana in the body. So let's talk about what does it do to the body. Number 1, it targets the cannabinoid receptors in the brain. It overactivates the natural endocannabinoid system, causing the high and other effects. They talk about feeling high, that euphoria, okay? Distorted perception, impaired coordination, difficulty with thinking and problem solving, and disrupted learning and memory. One of the things that we're seeing, especially among young kids, is because it's being referred to as a medical marijuana, it must be okay. If a doctor would prescribe it, it must be okay. So their sense of harm now goes way down. Okay? And so, again, the impact that would have on our young people as they're learning, as they're growing. And doctors will tell us that your brain is still developing up to age 25 or 26. I had a 9-year-old kid tell me that he's already done meth. Not smoked his first cigarette, not drank his first can of beer, but 9 years old has already experimented with meth. Again, you can see the marijuana effects on the brain. I'm not going to go into all the medical terminology, but it has an impact on every part of our brain and brain development. The other negative effects, number 1, it increases heart rate. It increases anxiety, paranoia, and panic attacks. very, very poor concentration, increased appetite. What does a normal marijuana user do? They'll go home, sit on the couch,
Eat Doritos.
smoke a joint, and make a run for the border. Taco Bell, okay? So it does. Again, it increases the appetite. It diminishes inhibitions. All right? Where you find people willing to take off their clothes and dance on the table. It increases risk for AIDS and other STDs, again, because that inhibition is down. Now they're thinking about doing things, or they start doing things that they normally wouldn't do. Smoking can lead to same problems as tobacco smoke, and it contributes to accidents to self and others. Automobile, household, and occupational. So what are the signs of misuse? How do you know if someone, and we were talking earlier, Chief, that, you know, we have businesses that have employees that will take a break, and during their lunch break they may go and smoke a joint, and then they come back and finish working the rest of the day. Can you imagine on a construction site, or can you imagine working beside that individual that now may be impaired because at lunchtime they went and engaged in some type of substance abuse, be it a pill, alcohol, or certainly marijuana. It animated behavior, loud talking followed by sleepiness, dilated pupils, bloodshot eyes, distortions in perception, hallucinations, distortions in depth and time perception, and loss of coordination. Anytime you see a loved one that all of a sudden they start acting different, they start talking different, they start to look like they're losing weight, they start being distant, those are some things you may want to continue to look, what's going on? Is there some type of substance abuse that's going on? And it may not even be marijuana, it could be something else. So is marijuana addictive? Absolutely yes, it is addictive. The National Institute talks about estimates that I said 10%, but 9 to 10% of users become addicted. This increases among those who start younger. In 2011, an estimated 4.2 million people met the criteria for abuse or dependency on marijuana. I don't know if you all saw the news, but I think it's Boyd County, Kentucky, had a major drug bust. This guy was bringing back pounds of marijuana into our particular area. One of the things that I mentioned to you, they also are mixing that stuff up. When they get marijuana, and again, because it's in a plant form, they get a brick, okay? They can put grass clippings, they can put kitty litter, they are catnip, sorry, not kitty litter, but catnip, because what they want to do, they're wanting to dilute it down to get to sell more. So you don't know if you're buying it from this guy today and it's pure, or you buy it 3 days from him and he's diluted it down with something else. You don't know if they've mixed other drugs in there, which they certainly could do that. So again, 4.2 million people met the criteria for abuse or dependency on marijuana. And when trying to quit, users report withdrawal symptoms of insomnia, hyperactivity, decreased appetite, inability, irritability, anxiety, and drug craving. That part of that brain that wants to have that drug over and over and over. So what's the effects on a heavy user? Number one, heavy marijuana use reports lower life satisfaction. They're not happy. They're not satisfied. All of a sudden, you know, they've quit going to school. They may have had some problems at work. They wind up being suspended. They are always asking you to call in as a parent. Call my teacher, call my supervisor, call my job, tell them I'm not feeling well. Okay? Poor mental health, poor physical health, relationship problems, and we're going to be talking about that more when we get into talking about heroin, what we refer to as drug-induced or drug-controlled or drug-impacted relationships. Okay? And then less academic and career success compared to non-using peers who came from similar backgrounds. So why does it matter? Number one, the battle of medical marijuana is not a battle for compassionate use. Okay, it's not a matter of taking a drug away from people that need it, because we already know that there are already synthetic drugs that can be used for this instead of the marijuana. but it's one step toward legalization. Of the registered users of the medical marijuana program in Colorado, 3% reported having cancer, and 1% reported having HIV or AIDS. Okay? The Marijuana Policy Project's 213 strategic plan states that the Marijuana Policy Project was founded with one reason and one reason only, the intent of ending marijuana prohibition. They want to get marijuana legalized. So if we can put it over on this medical terminology. Now, this is not going to be the first time that this has come up in the state of West Virginia. It's come up in years past. And they've actually looked at marijuana legalizing it as a cash crop. They're not necessarily looking at it even as a medical use. But if West Virginia figured out a way to regulate it, and you'd have to buy a permit to grow it, you'd have to pay taxes on it to sell it, then how much money could the state of West Virginia make off this? But can you imagine the can of worms that now may open up? How old do you have to be to buy tobacco in West Virginia? 18. You know what the average first user of tobacco is in West Virginia? 11. 11. Okay, if you had to be 18 to get tobacco, but the average age of a first-time smoker in our state is 11, what that means is we got kids 6, 7, 8 years old that are doing it too to get to the average of 11. Think about that. Okay? Do we regulate tobacco? Absolutely. Do we tax it? Absolutely. Do you have to have a permit to sell it? Absolutely. When I talk to kids, here's what kids tell me, Mr. White, I can get tobacco, alcohol, and drugs from home. That doesn't mean that mom and dad are giving it to them. It just means it's available in their home. Mom or dad smokes, so the kid can take a cigarette, or his friend or her friend can take a cigarette out of the pack. Mom and dad's not counting them. Dad's got a case of beer, in the refrigerator. The child or a friend of the child goes in, takes out a can. Dad doesn't count them. I mean, they have a liquor cabinet. Dad's not marking the line on this bourbon. So kids go in there and do a quick shot. 70% of them say they can get those things. Prescription pills. That's another major problem that we're having. Kids have access to those at home. If I were to break into your home looking for drugs, the first place I'm coming is to your kitchen. How many of you have your prescription drugs laid out on your countertop because you take them first thing in the morning with your coffee or your toast? Okay? Second place I'm going to go is to your bathroom because I'm going to look in your medicine cabinet. That's why it's called a medicine cabinet. Third place I'm going to go is your nightstand because you take your medication at night. So how easy, if I am a drug addict and I break into your home, how easy would it be for me to find my pills in your house?
You have to get past the dog.
Have to get past the dog. But think about that. Think about it. What I tell people is this. Put your medication in the coffee can, set it on the shelf. Now, you can certainly buy these prescription lock boxes and things like that. Just put a coffee can, put them in there. One thing that we work very, very close with, every year, every 6 months, we do a prescription take-back, where you can take your prescription drugs that are unused or expired that you don't need, and you can turn them back in. It's amazing. In Cabell County, we had a lady that brought medication that was dated 1974. She'd had that in her cabinet since 1974. Okay? So again, the intention of this thing is to legalize marijuana. They're going to use it behind the debate of it being medical. And again, in the state of West Virginia, well, let's just legalize it and we'll make money off of it. But look what happened when I was talking about the problem that we have with tobacco, and all of a sudden prescription drugs are legal. West Virginia leads the nation. We have more people dying from the non-medical use of prescription pills than any other state. The average prescription written for every man, woman, and child in the U.S. is 12. Take a guess what it is for West Virginia. It's 19. Ladies and gentlemen, there are 19 prescriptions written for every man, woman, and child in our state. And then we wonder why we have a prescription pill problem. The average across the United States is 12. The U.S. is the most medicated nation on the earth when you look at all the other countries and what we do. Okay? So, again, what does it matter? As we continue to accept medical marijuana, we are sending a message that it is not harmful. As the perception of risk of harm goes down, use goes up. There you go. Okay? High school seniors, past year marijuana use and perceived risk of marijuana. The blue line is their use, and the red line is their perceived risk of harm. Okay? So when you look back in 75, again, the higher the use, the lower their perception. Then we did a great job of educating folks about the problem with marijuana. So you started to see it, now we're starting to see it again, starting to spread out. And again, this is by age. Again, it's maybe a little bit hard for you to see, but that's the percentages in West Virginia compared to the United States. So what's the effects of the developing brain? A new large-scale study in New Zealand found, after controlling for multiple for factors, that marijuana users who began in their teen years and continued use showed a significant drop in their IQ. Again, independent study in New Zealand. Participants were administered an IQ test at age 13. They were re-administered the IQ test at age 38. Those who used in teen years and continued use had an average drop of 8 IQ points. That could drop a person from average to the lowest third of intelligence. So for the future, we need to further examine marijuana as a scientifically valid way. Again, science is based in prescription drugs and things in the medical field, long-term studies, larger numbers of people doing it, okay, what they call longitudinal studies. One of the problems that we have in the United States is, you know who tests the prescription drugs? The prescription companies. The people that create the drug are the ones that test it. All right? And they're the ones that say, yep, it's good. You all may know West Virginia received a $44 million settlement from Purdue Pharma over the national lawsuit on oxycodone. In their study, they found out it had a very, very high addictive cause, and they kept that hidden. And when it finally came out, I think there were 8 states that filed lawsuit. West Virginia was one of the 8, and we got $44 million from one pharmaceutical company because they hid the results of some of their testing on their own drugs. Okay? So, to continue to study the harms on those who use, we need to develop best practices to intervene and treat individuals who use. So what happens is we give someone marijuana for an illness, that illness is alleviated, but now they've got an addiction to marijuana. Now what do?
Is that not better than the prescription drug abuse?
Same thing. We got the same problem. So what happens is, it's not a problem. It helps me deal with my problem until it becomes a problem. And I'm very honored to work with Prestera. Prestera, we provide services in 8 counties. Wayne County is one of the counties that we provide services in. We are dealing with professional people who, a pregnancy, a car wreck, a surgery, were given a prescription drug, but over time became addicted to that, and they're not there because of their elbow or their knee or their hip replacement. Now they're coming to Prestera because they've got an addiction to their prescription drugs. They're not bad people, okay? But all of a sudden, you're exactly right. The same problem we run into, same problem with prescription drugs. So we need to, again, to develop best practices and then conduct further research on the health benefits. So what's the bottom line? We know more about the long-term negative effects than we do of the medical benefits. While many states have approved marijuana for medical use, it is not approved by the FDA. And it is still classified as a Schedule I substance on the Controlled Substance Act. All of our drugs they're scheduled 1, 2, 3, 4, and 5. A Schedule I drug means there's absolutely no medical benefit to it whatsoever, and if you are in possession of it, these gentlemen have a right to arrest you on the spot. There is no medical benefit to LSD. It's Schedule I. If you have it, you will be arrested. They're saying there is no medical benefit to marijuana. Therefore, right now, if you're in possession of it, you will be arrested. A Schedule II drug is a prescription drug. There is medical benefit to it, But the only way you can get a Schedule II drug is through a doctor. Okay? That would be your Xanax. That would be your hydrocodone. Okay? So if you have a prescription for that and you get pulled over, you're fine. But if you are in possession of a Schedule II drug and you cannot prove to these officers that you have that prescription, you will be arrested. Okay? And then Schedule 3, 4, and 5 would be your vitamins, over-the-counter, things like that. So this is still a Schedule I drug. All right? So, again, these are the references that we've used when putting together the training in the PowerPoint. What I'm going to do now is we're going to switch over to heroin. And when I'm done with that, then we're going to bring our panelists up and then we'll take any questions you guys have about marijuana or about heroin, okay? Feel free to get you a snack.